The first problem, and the reason that I initially came, I had had my teeth cleaned, and my old dentist said, oh, everything's fine. And I got home, and within a day or so, one of my teeth really hurt. And I called him back and said, yeah, my tooth's killing me. Something's not right here. Oh, no, it's fine. Come back in. I went back in. He goes, there's nothing wrong with your tooth. And I said, but it hurts. He was like, well, maybe you need to get an endodontist to look at it. Maybe you need a root canal or something. So you can just make an appointment. I thought, I'm not really comfortable with this. And one of the men in the office came here, and I remember hearing all these good things. So I was like, I'm going to call Dr. Sampalis. I came in, he took one look in my mouth and was like, that guy told you nothing was wrong? He said, I have to take the tooth out. I mean, it was a huge mess. So, I was very upset thinking, oh my God. And then as he looked at the rest of my mouth, he was like, there are some other issues. And I left almost in tears because I thought, oh my God, this is overwhelming. I'm not going to be able to do this and whatever. And he worked with me, we did the extraction first. He explained everything and then, said, okay, well, we'll do this one first. It's the most important. Then we're going to go on to this one. Then we're going to redo that one. It's taken him a couple of years to work through all of it. But he fixed a problem that was bad. I couldn't chew on my left side. It was just tender. I was taking a leave or whatever to take care of the pain. So, he immediately started cleaning all that up, and there was infection, of course, under the tooth. So, I had an antibiotic that I took. Within the first visit or two, it felt better already, and granted, it's a long process when they have to take a tooth out and you have to wait for the bone to heal and a graft and stuff, but it was well worth the wait. It was very easy. You come the first visit always seems to be, okay, let's figure out what the problem is. We're going to get started on it. It may involve a procedure and some work in the office, and then he'll say, okay, I want you to come back in 2 weeks. So he lets you know exactly what the procedure is going to be from the get-go. It'll be 2 weeks, then you're going to come back for this. Then I'm going to fit you for a crown, and we're going to send it out, make sure that it's perfect. Then you're going to come back in. He's extremely diligent and very meticulous with his work. Making sure that as I bite down, is the bite correct? How does it feel? I've never known anybody who worked so hard to make sure that my bite was absolutely perfect. He'd say, no, we're going to try one more time. No, let's do this. But I liked the fact that I always knew from the get-go what the process would be. He always shares that.